by virtue of my gray hair, I've been around for a long time. Indeed, the Asian American Family Services is a very unique organization. We're the one and only mental health agency for the Asian Americans, not only in the state of Texas, but in the entire southwestern United States. So indeed, our staff speaks many, many different languages, and we have to do a lot of not just intervention, but prevention services for our community. Today, I just want to share a little bit about the Asian American community. Who are we? And help you understand a little bit about our culture and the barriers that we faced, and some of the behavioral health disparities that we are talking about. Since we're in behavioral, my agency is really dealing with behavioral health. Talking about availability, accessibility, and utilization of those services in the Asian American community, and hopefully identify some of the best practices in the community and some resources to share with you all. It goes without saying that cultural competency is a journey, not a destination. So hopefully today, I've learned a great deal already from hearing about the two different cultures, and I hope that I'll share some of mine with you all. Who are the Asian Americans? What are we talking about? There are so many different people that are lumped together. He's no longer here. Dr. Sayer said that the Filipinos are lumped together as Asians. The federal government, the U.S. Census Bureau lumped more than 26 subgroups together as Asian Americans, or as APIA, or as APA, or AAPI, and that all stand for Asian Americans. So today, in short, when I said Asian Americans, I'm talking about AAPI, whatever, okay? And now the government also included the Native Hawaiians. So you'll see in some of the literature, we are now Asian American, Native Hawaiian, Pacific Islanders, so ANPI. So it's just getting longer and longer and longer. We're all just going to be lumped together. But I want to stress to you that we are not a homogeneous group of people at all. We're extremely diverse, not only in our languages, our background, our cultures, our food that we eat, and religions and beliefs, as well as celebration and holidays. Did you know that the month of May is Asian Pacific American Heritage Month nationally? So we're very happy. Since 1992, the president had designated that whole month as Asian Pacific American Heritage Month. Yours truly is a co-founder of the APAHA, the Asian Pacific American Heritage Association in Houston, Texas. And of course, you all know, I hope, that the month of May is also nationally the Mental Health Awareness Month. So it behooves us to really know about these, right? I talked about how we are very diverse. We're more than 26 subgroups. So when you think of an Asian American, what comes to mind? You guys are cheating, right? Because I already put that up. So are you guys not surprised? Some people say to me, what, Indians and Bangladeshis, they are Asians? Some Arabs from the Middle East, they said they are Asians. We don't exclude. We don't want other people to exclude us. So if you want to call yourself an Asian, go ahead, right? So, so we just like to share our culture and share theirs with us as well, okay? So here's a little map that shows you where we all come from. This is an old slide. I was not able to pull up my new ones. You can see that Texas actually ranked number 4 in the country, having the highest number of Asian Americans. This is an old data, but I will share with you that actually in 2010, our population jumped by 45.6%. In 2010, it's now 17.3 million. So it's now making up 5.6% of the U.S. population. Okay. So that's a projected growth that you see there. In 2000, Houston ranked number 8 in the country as having the most number of Asian Pacific American Islanders in the city. Because I come from Houston, so I could talk a little bit more about the Houston AAPI community. Houston, as you know, is the 4th largest city in the country, but we have the 8th highest number of AAPI. We have now over, I believe, 7% of our population are Asian Americans. These are national data. I have highlighted them in red, how we are actually, in terms of education, everybody think, oh, Asian, we do value education, and however, it really, depending on what subgroup they come from. But in general, the Asian Americans has the highest number of college graduate degree, actually, okay? In Houston, these are the highest number of, I guess, subgroups. So people think, oh, it's all nationally, Chinese is still the highest, have the largest number of Chinese in the country, but Vietnamese now outrank Chinese Americans to a point where about 6 years ago, they have enough registered voters to warrant our ballot to be translated into Vietnamese. And just last year, Chinese finally had enough people as registered voters that they have also gone into translating those ballots into Chinese. I want to just say a word about honoring people's differences, you know, how we always just lump people together. Please be sure that when a Taiwanese person tells you that they're Taiwanese, don't argue with them that they're Chinese, right? Or vice versa with the Indian and the Pakistani, because the political background. Okay, so we wanted to really honor people's differences and look at what countries of origin they come from. Look at the languages and the waves of immigration, where all people from other countries, other places, so how they come into this country is very, very important. And of course, the socioeconomic background and the acculturation level of all the various people that comes into place here. Religions and belief, I will talk about that a little bit. Becoming American. Nationally, this is kind of alarming statistics in that 88% of the Asian Americans are foreign-born or have a parent that is foreign-born. Those numbers have changed a little bit, but not much since the 2000 census. And 58% of the Asian Americans still only speaks their native language at home. So think about that for a moment in terms of the kind of services that you might need to provide for the people that you come into contact with. So if they go home, they only speak whatever language they speak. So just like people speaking Spanish, you know, you need to provide those language access to them. This is old data in 1995. Some of you will know that Dr. Stephen Kleinberg of Rice University does this Houston area survey. He did it for, 30-some years now. And in 1995, a group of Asian Americans went to him and said, why don't you include the Asians in the study? Because he's always done it just for the whites, the blacks, and the Hispanics. And we raised about $250,000 for Dr. Kleinberg and asked him to include the Asian Americans. So that was the very first scientific data that we have had on Asian Americans in any city. So we're very proud of that. And out of that particular thing that I got out of it was that same thing. 90% of the Asian American in Houston at that time were foreign-born. Some of you know about these, but I just wanted to ask, there's not too many young people around, right? Did you guys ever, when you were in high school, have you heard about the Chinese Exclusionary Act? Nobody ever talked about it, right? Chinese, in fact, were the only race that was excluded by Congress, by law, coming into this country. And that act was finally repealed about 65 years ago. So we still commemorate that in this country. Most of you know about the Japanese internment in 1945, and just want to talk about the changes in this country, the landscape of the immigrants, really because of the 1965 Immigration Reform Act to bring the family unification of people who have specialized training that come into this country. I am a beneficiary of this 1965 Immigration Reform Act. I came into this country when I was in 1967, so because of that law. Many people, particularly the Indian and the Filipinos, they did not have families here, so they could not utilize that law, but they were in the specialized training route because they are medical people and engineering people. I know that lots of you know about the fall of Saigon and the boat people and all that. And do you now know that we have a large number of refugees from Burma and from Bhutan? And those are the people that we are really dealing with right now in our office, in our setting there. When we come into contact with someone, I think that the country of origin is very important. The time of immigration is very important. And what do I mean by the time of immigration? And not just in the time of the persons, what year they came. I told you I came in 1967. So I've been here a long time. Guess what? I was 17 years old. I didn't speak a word of English. I immigrated here with my entire family. My parents were in their 40s. They never learned English. So that affects the year and the time that they came here really affect the way and the rate of acculturation. So yes, 17, I learned English. I grasped the culture. So I consider myself pretty bicultural, but my parents to this day. My father just passed away last year at 93. He didn't speak English at all, so there was no way for him to communicate with people. And the reason for immigration, why did they come here? Did they come here because of learning higher education, or do they come here because they already have a graduate degree? They come here for specialized training, or do they come here because of refugee status, or someone like myself who come here as an immigrant? Okay. So we want to bring all those factors into it. I know there's a lot of Spanish-speaking colleagues here that might come from many, many different countries, but in the Asian American community, there is no single language that ties us together at all. So that is one thing that we must remember when we are trying to provide care to someone. I remember very vividly a policeman called us and said, "I have an Asian here." Okay. She could not communicate. So I had to ask him, what language does she speak? He said he didn't know. So fortunately, our office had many different staff. So like everybody gets on the line and trying to talk to this person, And finally, we discovered she was actually Korean. So we were able to help her. So remember, when you're talking with an Asian American, yes, everybody lump us together and call us Asian American, but there's actually no such thing. So always ask what particular language or ethnic background. Even if they say they're Chinese, they have many different Chinese dialects. So someone from the north cannot communicate with someone from the south. And even for Beverly, whose family is from the region where I was from, but she only learned her village to communicate with people that speak Cantonese like myself. So anyway, so those are just some of the things that I wanted to share with you all. Particularly in the Chinese and the Indian communities, there's so many different dialects that we are dealing with. Here's a little pointer that I wanted to share, is that we have some languages, Asian languages have no gender, meaning that he, she, and it all refer as to one word, ta. So when you're talking, you get, even for people who are highly educated, who's been here many, many years, we would get that very mixed up because we just use that one word. Just yesterday, I was talking to my son, and I said something about my daughter, my granddaughter, and he said, "Mom, she's a she." I said, "I know that." And she said, "But," he said, "you just said he said that." I said, no, I didn't, So it just comes out. So if you're confused, particularly if you're doing deposition, if someone, like a domestic violence case or something, if you don't know who they're referring to, because this moment they said she, that moment it's a he, and then it's a it, like, what are you talking about? So just be aware of it and just clarify with them what it is. And we also, some of the languages have no tenses. The past, present, and future is all the same word, same thing. So you don't know whether it had already happened or it's going to happen or it's happening now. So you can clarify that with the speaker, okay? I always tell people there's no such thing as an Asian New Year. So we all celebrate different New Year at different time, okay? Death anniversary is very, very important in many of the Asian culture. We honor the people who went before us. We honor our ancestors. So when they pass away, that day is very, very important. So we light incense, we do prayers, and so we don't only just celebrate their birthday, we celebrate their death anniversary as well. So those are important dates for us. Lots of people think, geez, Asians, are you Buddhist? I happen to be a nothing. Right? So, but do you know that in Malaysia we have the highest number of Muslims in the country, in the world, actually, concentration-wise, okay, percentage-wise, okay. Many of you have heard about feng shui, right? What is it? A few years ago, there's feng shui candle, feng shui this, and feng shui that. Really has absolutely no meaning for people who don't really practice it. But I haven't studied it. I'm not a scholar of that. But I lived it every day. Feng shui has a great deal of influence in the way we lived, in the way we deal with our parents, or even our loved ones. A case in point, we had a young girl, 11 years old, that came into our center because of hallucination. And the parents came in, and we said she needs to see a psychiatrist. The father said, no. I'm going to call my mother, who lives in California, and she's going to go to the temple and pray. And we said, no. And she said, that's bad feng shui. We believe that how the ancestors are buried, where they are, and how they were buried, the feng shui means it's a geomancy, okay? So the balance of heaven and earth and all that stuff. Like I said, I don't know what it is, but we believe in it. So they were going to go back and do something to the burial site for the grandparents that affected, because the grandparents are affecting the next generation. So they were going to do something about it. So bear in mind that when they said this, it's not really an excuse. They're really believing in it. Okay, so I think these are very common and very applicable to all of the cultures that we talked about. But in the Asian culture, most of all, we have such a hierarchy that in a very traditional family, the male and female roles are very defined. We have such respect for the elders, it's not even earned, okay? Just because you're old, that's what I say, people, okay, look, I earned it, I got all my gray hair, unfortunately, I'm not a male, so I don't earn that privilege as much. These kind of cultural stuff, this kind of family structure actually have some influence in the way we make decisions. Let me share something with you. My mother was very ill, was in a hospital, and we were told that she might not survive the surgery. And we were told that to get the whole family together. So we did a very unusual thing here. there's 7 siblings plus my father. We all got together and trying to make a decision on behalf of my mother's health condition, which is much, much against our tradition. Only the father and the oldest son get to make those decisions. But the doctor saw that I was the most fluent in English. I happened to be married to a physician, so I understood what he was talking about. So he would come to me and tell me, you need to do this is what we're doing, which really offended my brother. So they got really upset, So just remember those kind of things can impede in your care to your clients or patient. In this country, we talk about me as an individual, but in the Asian culture and many of the culture that we mentioned today, we are more of we, family, clan, the village, the whole community, and so we talked about this shame, this how you bring shame to not just to yourself but to your whole family and for your whole clan. So oftentimes people will say, I cannot do this, So communication style is very, very important when you're providing care. These are just some things that I wanted to share with you, is that we valued and we think your credentials is very important. So for the master level therapists who are providing care, they often get called doctor, because the people feel better that they're going to a doctor, and they think that you have such, you've earned it, So they always say, geez, I want to see Dr. So-and-so. We say, no, it's Mr. So-and-so, and they get very upset. So introduce yourself when you, in your practice, make sure that they do know who you are and what you do for them. And most importantly, to always instill a sense of hope for the clients. Establishing trust with the clients is very important. In our culture, confidentiality is very, very important. Let me go back over here. We do therapy at our office. We do counseling and psychiatric treatment. But in terms of what you do in your daily practice, know that our people need to be more directive, because they wanted to know what you can do for me. They are not seeking help, and you are the expert, so you tell me what to do. So I think this is also applicable for someone who doesn't speak the English language well, is to be patient with them, to ask them to repeat your instruction. You ask them to do something. Don't just say, go home and take a pill, 3 times a day. I was just telling Shane that I was taking some medication and misread the instructions, so it could have disastrous consequences. So particularly with medication. So make sure you ask them to repeat to you what you're saying. Explain the treatment process and set goals and be very concrete. Now, I think someone here talked about the PTSD and trauma and all that, but anyway, I think it's the item number 4. Do not talk to interpreters. Because you're not able to, very likely you're not able to talk directly to the client because you don't speak the language. So very often you have to call an interpreter. But please, don't just ask someone who's walking by the hallway, the janitor, whoever, a child and all that, and say, hey, explain to them what's going on. Because 1, they don't know. And 2, you really have to respect the clients. You're really talking to the client. You're not talking to the interpreter. So we do interpreter skills training. We always said to them, look at the client as if that client can communicate with you. The interpreter should be in back, and it really just the mouthpiece. So that's something very, very important to carry out when you use an interpreter of any language. Okay, I know that you talked about eye contact, about how we look. People see here. I've been trained, right? I'm looking around the room. I'm engaging you. I'm having eye contact with you. But in our culture, direct eye contact is a sign of disrespect. So that's very important. Some people said, look at me when I talk to you, like that's not it. Particularly when you're talking to an authority. So if you're in a setting where they see you as an authority, even in a therapy situation, they often would look down. They cast their eye downward. So just don't think that they're not respectful. Dr. Gore is going to make the presentation later on, and she mentioned to me about something that I wanted to share. When the Asian are smiling and nodding to you, it does not really mean they say yes. It does not mean they agree. They are just trying to be very polite. Okay, so that particular person that when Dr. Gore is going to mention had very grave consequences because the person misinterpreted the nodding as a yes to go forward. Okay, so just re-emphasize to them what you mean. I already talked about how the ancestors and the people who went before us are very, very important. So. This is something that I think that is very applicable to all of us, no matter what we do. And this is the model that we use at the Asian American Family Services when we're looking at working with anybody, whether it's in a psychiatric treatment setting or therapy or even just as in case management. Is the holistic approach. So look at a person as a whole person at many different spheres rather than just like, oh, you come in, you need therapy, what is it? So most importantly is to look at the biosocial, psychosocial, and cultural and political factors that are really impacting on the client who are seeking care from you. What are the biological factors? I see that a lot of nurses here, right? So, make sure that we really have a good understanding of those chronic conditions, simple things like diabetes, hypertension, even like acid reflux, those kind of small things that really bothers them in their daily functioning. And, of course, the cancer and the HIV and other more serious ailments really, of course, affect how they work in their daily lives. So, and not just look at people's ability, but also look at their disabilities. And in our office, we talked about a lot about psychological issues. So we wanted to make sure that we understand their drug and substance abuse history or dependency, and very importantly is to see whether there's a family history of psychiatric treatment. And Dr. Sayers talked about the history of suicide, and that is very prevalent in our community as well. Social factors, how we deal with one another, family dynamics, the interaction styles, all of those things really affect us, the emotional connectedness and relatedness with one another. How we communicate, setting boundaries, and all of those are very important. Roles and responsibility and expectation, that is very... takes a very dramatic position in the Asian culture. Some people feel that a lot of kids who are having problems is because they could not conform to the parents' expectation. And so there's a certain role that they have to fulfill. So, of course, today we're talking about all the cultural factors, right? So our values, our belief systems, and our traditions, and all of those. But I already mentioned, even just knowing how long they've been in this country and how do they feel they can fit in, whether they're able to navigate the system is important to know. Okay. I think this is the one factor that other people may not look at on a daily basis is the political factors of the people that you are serving. In our community, because we have so many people, we're mostly immigrants, and then how we come here and whether they have a legal status, what the immigration status is. We have a lot of people who are on student visa who don't want to go back home. They just want to stay here. So they are seeking employment, doing all kinds of things that you need to be really aware of. At our office, we have several H-1B visa employees, and because they don't want to go back. You know why? So you don't want to hold them hostage just because they're seeking an H-1B visa either. You know, so we have a lot of clients who domestic violence victims who really came here because they didn't want to be in their home country, and yet at the same time, their husbands or the spouses will hold them hostage because they don't have a legal status unless they've been here at least 2 years. So those kind of things really impact on how they are seeking care and all that. So look at the barriers to care. I think quite a few of us talked about language and cultural issues that are affecting our care system here. So our agency was founded to really deal with these 3 issues, which is availability, accessibility, and utilization of healthcare system. We have all the same issues as everyone else. We're just human beings. So we see maybe you would call the garden variety issues, okay? You know, you got problem with your family, your kids is not behaving, they're not listening to you, and we have the sexual abuse, we have the child abuse, we have drug abuse, we have everything under the sun that you can think of that we're dealing with at our office. But so we are not different or unique in that sense, but our challenges are a little bit more unique due to our language and our cultural issues here. So in order to really to promote health equity, we really need to look at what is available to help the people when they are seeking help. So what is the first thing that we do is to make sure that we can provide culturally and linguistically competent services for people in whatever language that may be. We want to have people who are trained that can really provide those quality services rather than just anybody who can speak a particular language doesn't mean they are able to provide those good care to them. And funding to fully support those needed services. So here I want to say a word of thanks to Dr. Martinez with the Hogg Foundation for Mental Health, who's really truly given birth to the Asian American Family Services because of their belief in the needs in the Asian American community in Houston, and funded us continuously for different projects. So we are very, very grateful, and we need more foundations and the federal government to understand the needs in services that are really needed, not just for the Asian American, for others as well. So accessibility. So what if you have it available? Can people access those care? So in Houston, we don't have, I don't know about Austin, we don't have a good public transportation system. So the lack of transportation will prevent a lot of people from seeking care. I clearly remember we have this African-American senior citizen who was suffering from a lot of trauma, a lot of major depression after Katrina. She would every Friday take 4 buses. Her appointments always at 2 o'clock because she come from the Northwest Houston. She'd take 4 buses at 8 or 9 o'clock to get to her appointment at 2 o'clock. Because she said we were providing the kind of care for her that she wanted, she needed, and she really feel the support in our setting. So she would do that. But how many patients, how many elderly having issue would spend 5 hours taking 4 buses to come to a place to seek care? So we really have to think about where they're coming from. How can they access the care that they need? Okay. And the hours of services, okay, we need to be able to meet what they need. So we open like late. Evening hours, you have to open on a weekend so that they can access it when they need it. Particularly for kids, you can't just say you have to come in the morning because they have to take time off from school, or the parents have to take time off from work to take them there. So we're always trying to have evening hours for the family members to come together. So. Utilization. Services, it's no good if you have it available, you even have it accessible, but people don't use it. Asian Americans are the least likely to use particular psychological services or mental health services. So it has to be utilized. So what do? We need to really help educate the people what you can help them with, why they can their problem can be resolved, and so a lot of public education. I didn't get to talk about the face factor. We always use this word, face. Give me face really means give me honor, don't shame me. So a lot of Asians don't want to share their issues in public. They don't want to share with other people. So they have trouble saying, I need help. Okay, so they don't utilize the system because they think it's a shame to use those systems, or the lack of resources to pay for it. In mental health services, is very different than physical health. So we need to really integrating that as part of our total health, because people think, geez, talk therapy. What are you going to do for me? They don't see the value of psychological services or mental health services, so they don't come. So about the knowledge, we have to give them the information, empower them to come. Okay. And I'm sure in the Hispanic community we have the same issues as well. Since I'm graying, so I want to talk about the graying of America. Senior citizens, people over age 65, are going to be a large percentage of us will be old soon, already there. So for our elderly in the Asian community, they often feel very isolated, and because back home, we like the adult children would take care of them. You have the multi-generational household, where here we no longer have that. So not only are they living by themselves, but they cannot get around. They cannot speak the language and all of those. So those things are really impeding them from seeking care. So these are just some of the things that a wish list for myself to talk about the senior citizens, for us to provide culturally and linguistically competent services for the seniors in terms of assisted living, in terms of nursing care, nursing home, and recreational daycare, and all those. So we as an individual can do a lot, but we as an organization, we as community can do something about accessibility and availability and the utilization of care. AAFS, that's the Asian American Family Services, these are some of the strategies that we used in terms of helping to promote health equity in the Asian community. One is to be very consumer focused. And two is really to provide linguistically and culturally competent services, and to provide holistic approaches, wraparound services. So when a person comes in, they don't say, I need to see a counselor. They say they have some other stuff. So when you're doing case management, that's when you really realize that what might be going on, so you make a proper referral. We go out into the community. We do about 16 weekly workshop for the youth, and about 9 workshops, support groups for the senior citizens in different languages in the places where they are. So we go into the senior housing projects, we go into the apartment complexes, we go into schools where they are to provide those services. So it really need to be consumer friendly. I just already talked about extended hours and low cost or free is what people are seeking. I think it's very important to do consumer education, using the ethnic media in whatever language that you are, and doing workshops in the community. Name change, I wanted to just touch base with that. Our agency was started in 1994, not 1999, but we were called the Asian American Family Counseling Center instead of Asian American Family Services. And guess what? That word counseling is a foreign concept. And people said, I don't have any problem. I don't want anything. I don't need help. So after 10 years, in 2005, we took that counseling away because we've been doing a lot more family-oriented services, more prevention-oriented services for the youth, for the family, for the seniors, and the entire family. So taking away that name sort of let them feel it's okay to come. So in fact, when we moved into our new building right in Asia Town, one woman came up, I happened to be up front, and she walked up and she says, I really like your name. I'm like, I don't even know her. How does she know my name? And I looked at her, and she goes, I really like your name. I said, and she goes, I guess I look really puzzled. We have a big sign because we just moved in. It says Asian American Family Services. She said, I feel so much better just coming up. She saw it on the street. We have a big sign, so you just come up because it says family services. So little things like that can make a difference for those particular people. Okay, professional people, counseling, of course we know what you do. But at our agency, we do a lot of supportive services, including legal consultation, clinic, navigations. There's now a lot of, I know there's a lot of Pomodoros here, navigators, and we do interpreting and translation for people. And as I mentioned, program for youth and for seniors and all that. I mentioned that Dr. Stephen Kleiberg he provided the first scientific data on the Asian American community. Dr. Lowell Jones and Dr. Beverly Gore at the MD Anderson Center for Minority Health. They've been really wonderful in collecting some data that's been useful for us, because when you don't have data, how can you tell people what problem you have, right? The federal government said, show me, everything has to be evidence-based, right? So having those data and having them analyzed is really wonderful. So that's what we really need to do, more research and more analysis on what we find. I know the Hart Foundation had a great big emphasis on the workforce challenge, in particular for mental health disciplines, and that is because we really lack people who are trained and licensed who can speak a foreign language, either Spanish or Asian languages and all of those. So we really need those people to come back and serve the community. So at the Asian American Family Services, we provide practicum and internship and postdoctoral fellowship training so that they could gain the experience and come back and serve our community here. So this is my last slide. Basically, it's really to ask every one of us to look at mental health as part of total health, total well-being. Don't separate it and include it. Okay, this is what we are, and I would like for it to be a public health issue that we're all going to be looking at together, rather than cutting it, all that. Okay. These are just some quick questions I wanted to ask you guys. but Dr. Sayers is not here. This is something that numbers 7 and 8 are some of very alarming statistics that we have found. Those data come from the Ford Foundation. People ask me why the Asian woman ages 65 and over has the highest suicidal rate in this country in that particular age group, or that the young girls ages 15 to 24 has the second highest suicidal rate in the United States in that age group. So I don't have an answer for you, but I would say that for the older Asian women, I think it's a lot of acculturation issues. So we're supposed to not talk about our problems. So when you come here, you're very isolated. You are not able to express that. So sometimes they just, might do some stupid thing like that. For the 15 to 24-year-old, every year you will find, we will hear about a young college girl, female students, particularly in very high Ivy League colleges, that will commit suicide. Why? Because of that role, that expectation, the honor that we talked about, that the parents expect them to do very well. So once they get up to the Ivy League schools in particular, they feel like they couldn't accomplish, they couldn't meet the parents' expectations. So in Japan, Japan has a very horrible system. Give me that 1 second, right? I know I went past my 1 minute. In Japan, we have the SAT for people who do the college exam. They have similar tests, but they published all of the names of the people who pass. So every year there's a Japanese student whose name's not on that list would jump off the bridge. And they still have not learned. They're still doing it. So anyway, that's just...
Thank you so much.
Thank you.